Hello, an implantable cardioverter defibrillator or ICD is similar to a pacemaker. It is a battery-powered device that is placed under your skin below your collarbone and keeps track of your heart rhythm. Your doctor may have recommended an ICD if you are at risk of a life-threatening abnormal heart rate, known as a ventricular arrhythmia. An ICD sends an electrical current to your heart to reboot it back into a safe rhythm. Abnormal heart rhythms, known as arrhythmias, are caused by an abnormality in the electrical conduction system of your heart. This can cause the heart to slow down, speed up, or beat in an irregular way. ICDs are used to treat arrhythmias that arise from the lower chambers of the heart, known as the ventricles. There are two main types of arrhythmia: ventricular tachycardia, or VT, and ventricular fibrillation, or VF. It is difficult for most people's bodies to cope if they go into one of these rhythms. If the abnormal rhythm doesn't stop quickly on its own, it can lead to a cardiac arrest. This is a medical emergency where your heart stops pumping, and unless immediately treated with chest compressions, will lead to death within minutes. If you have heart failure, you may need a CRT-D, which is a cardiac resynchronization device defibrillator. It is similar to an ICD in that it also helps the heart pump more effectively. The difference is that a CRT-D helps your two ventricles beat in time, rather than simply focusing on one side of the heart or the other. To do this, CRT-Ds have three wires that deliver energy to your heart, rather than the one or two that an ICD has. CRT-Ds are used in people with heart failure. An ICD continually checks your heart rate and rhythm. If the ICD detects a life-threatening rapid heart rhythm, it will firstly try and slow the rhythm back down. If this doesn't work, it will send an electric shock to the heart to try and restore a normal rhythm. If it finds your heart is beating too slow, it can send out an electrical impulse to make it speed up. In this respect, an ICD works in the same way as a pacemaker. Your specialist will program your device depending on the type of problem your heart is experiencing. If you have any further questions or would like some advice, please speak to your GP, cardiologist or specialist nurse.